Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. So what conditions can spine surgery treat the best? Well, in a short answer is, acute or traumatic injuries tend to be the most amenable to spine surgery procedures. Now, that does not necessarily mean that the trauma happened recently. Many times patients have been in a trauma even years ago, even in high school sports or college sports, and they've kind of been living with some pain that has just gotten worse and worse. And now it's 10 or 15 years later, and really they cannot handle the pain, or the neurologic symptoms have become more profound. So we need to address those surgically. So those are really the best situations, because typically that involves a problem at 1 or 2 disc levels, and the rest of the discs are essentially fine because we have essentially a otherwise healthy and non-degenerated spine. So we can be very sure that the symptoms are coming from those 1 or 2 levels, and addressing those 1 or 2 levels is going to lead to nearly 100% relief of the symptoms. Some of the more challenging times is when a patient perhaps is older or has an early onset of a degenerative arthritic condition. Even in those situations, there are times when perhaps, again, 1 or 2 discs are much worse than the other discs. And in those situations, again, we can expect relatively good pain relief, perhaps not 100%, but perhaps 80, 90, or 95% relief of the symptoms. And any remaining discomfort really is minimal, and the patient can return to most activities, including work and family activities and fun. Other types of situations where spine surgery is helpful: osteoporotic disease. So this is a disease of weak bones, and frequently those bones, particularly in the lumbar and thoracic spine, can weaken or collapse. Well, we have a very minimally invasive procedure. It takes about half an hour. It's an in and out type procedure where we can correct that collapse and reinforce that weakened bone. Of course, we also want to promote treating that weak bone disease. There are several other types of endocrine problems or hormone problems that lead to bone conditions and weakened discs. Some of these can also include patients who have chronic use of steroids. Steroids are notoriously problematic for the spine. They can cause weak bone, they can decrease the circulation to the discs and lead to collapse or early degeneration of the discs in the neck, lower back, and the mid-back. And again, these are situations where we tend to have more pointed single or maybe 2-level problems that a small, minimally invasive procedure can address and can essentially cure the patient of their symptoms. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.